Well, I think the point about how effective is a very important one, because it can be challenging to know if a blood pressure medication is working or not. And one of the points to get across is that our blood pressure fluctuates. It fluctuates throughout the day, over the week, and even from season to season. So I often see in my own practice, and it can be challenging for people to understand, that their blood pressure would be normal in the morning time, but actually quite elevated in the afternoon. And really that comes down to the individual variance, stressors and so forth. So I suppose when you're talking about effectiveness of blood pressure, it's important that you're using a reliable and reproducible way of measuring that. Because by random one-off measurements, you may not get that picture. You may think the medication isn't effective. So what would help us in that? Well, there's two ways perhaps. One is by using what we call ambulatory blood pressure recording. What that simply is that a blood pressure cuff is attached to your arm, and a small box no bigger than a transistor radio, or smaller than that now, a mobile phone perhaps, is placed on a belt or in your bag. And that will inflate every half hour, and perhaps less at night, depending on how it's programmed and the individual's preference. There's no great magic in this. All it does is create quite a number of values which can be averaged out, and it's the nature of that average adds to the strength of figuring out where an individual's blood pressure is. So first of all, it makes the diagnosis much more accurate, and then if we talk about effectiveness, it can obviously relate that as well, because if we repeat the monitor, we then should see if the medication is working or not. The other way it can be done is through the purchase of a reliable, validated blood pressure device. And I think, given that people are going to be on blood pressure medications for the rest of their life, it's reasonable to purchase that, I think, and take control of the entity and be involved in the management of your condition. And then to measure the blood pressure, not in a neurotic way or not in an overbearing way, but by the guidelines. And I would say that you should measure the blood pressure 3 occasions, a couple of minutes between each time when you're sitting down in a relaxed environment, and take the average of the latter 2. And that you would do that at the same time of the day, over a period of a couple of days, over a period of a couple of weeks. That allows you to know what your blood pressure is doing, and reminding you that anything over 140/90 is considered to be hypertensive. And that it also very valuable information if collected in that fashion for your GP, for your family doctor, for your healthcare professional, at whatever setting that is. So that has twofold. It helps to make the diagnosis, but coming back to the question in relation to efficacy, it allows to see whether the medication is efficacious or not. Then coming back to the idea of generic drugs, I think more and more drugs are becoming generic and so forth. So it's important that you have a good discussion with your family doctor as to the nature of the medication, why it's useful, why you require it, and what the potential side effects for this could be. But that it's also important that you live up to your side of the bargain and take the medication as prescribed, measure the blood pressure if needed or if suggested by your doctor, and report any side effects and indeed the response to therapy that you're seeing. But ultimately, these medications have gone through quite a laborious and exhaustive trial process to make sure they're safe and work efficaciously. And invariably they do, but also to bear in mind that it may be required that your doctor would have to add in further medications. Because the final point I'd make is that we see this, that the majority of our patients with hypertension will require a number of medications to get their blood pressure controlled. So do not be too disheartened if the first medication isn't sufficient.